Hi, Rhonda. It's great to see you. I'm so excited to talk to you, and I know our audience will be really excited to learn more about what you're doing too. And you have a really great perspective because you were able to, see this from the field and see this from
Mhm.
a client perspective. And I know that that's really helpful. Some of our best therapists and speakers and trainers all come from that perspective because they have a chance to, feel it and see it. So,
Mhm.
do you want to just give us a little bit about your background and what you're doing now?
Sure. Yeah. So, um, long time ago, I started in HR management and operations, and over time decided I wanted something different. And then launched myself into acting, and then eventually screenwriting and directing, which I really, really love. And then fast forward, and I'd gotten really, really sick, and also had been undiagnosed with the severe PTSD. And so I really had to be resourceful in my life and how to generate at least some income and such. And eventually I decided to go into a counseling program because I've always had a huge interest in the human condition. Wanted to be able to better understand my own mental health, and also wanted to be able to better support others and also better support my storytelling as it relates again to the human condition and psychology. So I guess in a way, I've been in the healthcare profession really for like since I started my career, because I think the HR side of this, the HR side of business is the helping side of business, right? And even storytelling. Storytelling is all about stories help us grow, evolve, heal, right? So, in my opinion, there's a very broad definition of the helping profession. So, and
That's
today,
so
I guess you did ask me about today, didn't you? So today, I work as a provisionally licensed therapist and also do a lot of career advice work, career advising for consulting work, and am transitioning into speaking and training when it comes to mental health and especially focused on trauma.
how did you even hear about ITR?
Yeah, so it was very serendipitous. I was working with a practitioner where I'd interned at the Barber Community Health Association in West Virginia. And I had been going for neuro stimulation treatments, and the therapist there, he knew I was having an increase in symptoms all of a sudden, kind of like a flare up of my PTSD. And he suggested, his name is Robert, he suggested I look into ITR because he found out about it and had been talking with you, Mary, and thought maybe it was a treatment that I might want to consider. So I got right online and looked it up and contacted you, and the rest is history, as they say.
So, how would you describe it to other people?
From a from a patient perspective or from a provider perspective?
Why you go for both? I don't
Both.
know. I think it's
Okay.
important since we
Yeah.
treat a lot of therapists, by the way. Yeah.
Yes. No, and I think that's amazing and wonderful, and I'm not surprised. So from if I were talking to somebody and encouraging them to look into ITR, which I do a lot, I explained that it's a treatment protocol that really focuses in on trauma and trauma symptoms. And what I love about ITR, and whether I'm working with and explaining it to providers or individuals who may be interested in the treatment, is that the first thing that happens is you understand the instinctual trauma response. You understand why your brain is doing what it's doing, and then just that piece of information alone, when I'm working with people that I work with, like when I educate them on that, it's like a huge relief. I can just see like their just shoulders drop, right? Because all of a sudden they're like, oh, um, okay, this is happening for a reason. It's not my fault. I'm really having these responses because I don't know how to control them. And my brain's just doing what it instinctually knows to do in certain circumstances, right? So that piece alone and is, I think, just so valuable. And it is one of the first things I would say is the education, understanding how the brain works. ITR is based in neuroscience, which I love the fact that you actually have that, right, to back it. And then from there, that it's a treatment that incorporates, some it incorporates the narrative therapy, the repetition of the story, the art therapy, and the externalized dialogue parts work. You blend these all together, and just the way it helps to rebuild the to create the neuro pathways. Am I saying that right? Yeah, the neuro pathways that we need for our brains to function optimally. That's what ITR does, right? It helps our brains operate the way they're supposed to do. And for me, in my experience, it finally gave me the opportunity and my brain the opportunity to timestamp the trauma that occurred, right? So where I've done other treatments, which I think we're going to get to that maybe in another question, ITR helped me. I would still have episodes where I felt still very much like a younger age, and where ITR after ITR treatment, I was just clear. I was like, oh, okay, trauma's over. My brain understood trauma is over. So that's a long-winded answer, but to put it simply for people, it is a trauma-informed approach that really helps process trauma versus just talking about trauma and giving you coping tools. You have the ability to truly process the trauma and heal and recover from the trauma. So your brain understands that you are functioning present day and the trauma from the past is no longer happening.
That's great. I know you had mentioned you had tried a couple other methods. Like, you want to talk
Mhm.
about your experience with those?
Sure. So personally, so my story is that I went undiagnosed with PTSD for years. And it got very severe. I really did lose everything. I was not able to function. It makes me almost want to cheer up now. I was not able to function as an adult. I had two master's degrees by the time I just wasn't able to function. I had worked for two of the biggest companies in the world, had made really good income by the age of 30 and lost everything because all of a sudden, off and on, I wasn't able to function. I couldn't do simple math. Um, I remember one time very specifically sitting at a computer at work. I was an HR operations manager and was sitting there, and I have like I said, I have the creative side, right, the filmmaking side of things, but I also have this like lucky to have, I guess, maybe this left brain analytical side as well. So I'd often be asked to do reports and spreadsheets and analyze data on top of my basic a baseline HR job. And I remember sitting there at the computer one day and just staring at this spreadsheet. I'd done it every month for a year at least. And I was sitting there and I sat there for 3 hours and could not, in no way was I able to figure out how to use that spreadsheet. And I remember finally calling my manager and saying, hey, I know I've done this forever and I really don't know how to do it right now. You're going to have to do it for me. And that type of stuff would happen a lot, right? And so I'm like sitting there going, something's wrong. This doesn't make sense. And my logical brain's like, one, this really doesn't make sense, right? I would, I would, I would cry. I call it spontaneous crying, in front of people that you don't want to cry in front of at work, right? And I'm sure they thought it was because of them, but it wasn't. It was because I had no control over what my emotions and what my brain was doing and what my body was doing from time to time. So it's really, really scary. So, they say like you use your looks over age, but at least you have your mind. And I'm sitting here going at the age of 30, like, I feel like I'm losing my mind actually. So it was really scary. So I in the past had been in therapy and had been attempting to figure out things. Had been going to doctors because I also ended up developing chronic fatigue syndrome, fibromyalgia, which I'm clear now are very much because of the trauma from childhood. And that's where my trauma originated largely due to sexual abuse, ongoing sexual abuse as a child, and then a lot of dysfunction, within the home that can happen with alcohol use. So there was a combination, so lots of complex trauma or lots of compounded trauma resulting in complex trauma. So then finally, when I really lost, like really couldn't function, could not hold down a job, I was close to 40 years old. So I went over a decade trying to figure out how to work and function. And I did, like I said, a lot of times I just wasn't able to. So the last really bad flare up I had, I fortunately had been on the phone with somebody who used to work in the field She was had a PhD in psychology, and she did workshops for women at this point. And I attended one of her workshops. We were talking on the phone afterwards, and so she had said something to me, that I was talking about speaking and standing in front of people and talking and how afraid I was to do it, how much fear. And she said, "Well, I'm not surprised you've never done this before." I said, "But I have. I used to be able to do that without problem. I would stand in front of thousands of people and be able to do that." And she sat there for a moment, and she'd gotten to know me a bit. Like, there'd be times where she's like, "Rhonda, you need to talk. You need to speak up. You need to share what you're saying." And I wasn't capable. I could not speak. And so finally she asked me what I've been diagnosed with. And I said, "Well, over time, I've been told I've been depressed, but not clinically depressed, anxiety, that sort of thing." She's like, "I suspect you have PTSD." So it wasn't even somebody who was practicing in the field. It wasn't one of my providers that actually shared this with me that helped me get the help I needed. It was somebody who was just willing to really listen and hear what I was going through. And so right away, I knew of a trauma therapist specialized in trauma. And first, I Googled and researched, and I said, "Oh, well, there we go. Okay." So I called this therapist. Fortunately, she had opening, and she had been working with veterans and PTSD cases for like 15 to 20 years at this point. And she offered EMDR therapy. So I'm in desensitization and reprocessing therapy. Um, so got in with her, and before that, though, it was always, let me back up and say, any treatments that I'd received before that were very cognitive based, right? So all the CBTs and the reality therapies, that whole talk therapy, cognitive stuff, right? So um and also when I was in any other treatments, again, that people were really just missing the fact that there was something else going on. It wasn't just your typical day-to-day challenges or just behaviors expressing themselves because of events and life events, right? Um, so those treatments I just did not find to be effective. And same thing, like in working with people, I think those treatments can be great to build rapport, right? I think they're great to help somebody maybe build some awareness and develop coping tools, but it does not help overall with symptom reduction, and it doesn't help process the trauma. So back to my therapist, Michelle. She did EMDR. We started right away. Fortunately, I will say with EMDR, about 3 months in, I felt a little bit more normal. About 6 months in, I was able to hold down a job finally again. Now I had to be very selective, very like just administrative type of work. And then within about a year, at least I was able to handle things where I wasn't having like on the kitchen floor, hands and knees, really bad episodes or extreme numbing, those type of episodes. So it took about a year of solid work. And then probably I was still though having some episodes for about 3 years. I'm a good student, and I really did a lot of work to get to where I got about 5 years later. And it's around that time where, I say I would got about 85% there, about 85% to the point where at least I was about that level recovered, but was still again having symptoms of flare-ups, and things were getting a little bit worse at one point. And there's when I got introduced to ITR. Now, what I will say about the EMDR and what I believe with my therapist, the EMDR worked so well for me is because she also used parts work, so the internal family systems work. And I think the combination of those two things allowed me to do a lot of work at home. So if you talk to my therapist, she'll tell you did about 3 years of work in 1 year, because like, every day in the mornings I was doing parts work, right? Just a lot of it to help unburden parts. And then that really helped in my recovery, I think. And then, again, when I think about that, I think it's those two combinations is why I was able to get to the point that I did as quickly as I did. I think EMDR alone can work well, but I think it has its limitations as well. Yeah.
And after you did ITR, or what do you think like ITR provided that maybe you didn't find in EMDR? Just wondering from your perspective.
ITR for me, I believe what it did was help. Again, the biggest thing was it did give an stamp to the trauma. EMDR really helped, I think, uncover some major memories, the subconscious, memories and such. It gave me the right kind of time frame, I think, for my brain to be ready to acknowledge a lot of the really bad things that happened. But it didn't timestamp the trauma in the way that ITR did. And what I mean by that is like, you know, after ITR, I would always do this is an exercise I always do every morning. I'd ask myself, how old am I and how old do I feel? And, you know, the whole I how old am I? If any number comes up other than present day, then it means I'm dissociating. There's a part coming up trying to come up dissociating. Now, how old do I feel? Right? Is more like there's still a part coming up, but I'm more present day to it. Hopefully, I'm making sense, right? So I'd always ask myself these two questions. And usually, with the hell do I feel would always be another age or frequently be another age after ITR, but always consistently when I'd say, how old am I and how do I feel? It was always like my present day age. And then also, I just noticed that anytime I thought about the things that had happened or the traumas, there was just not, it's like there was just not this response of any sort to them. It was like, okay, this is over. That's done. Right. And also really love ITR because of the structure of ITR, right? I love that there's a formula for it too, right? So I think it makes it a lot easier for therapists to apply and practitioners to apply compared to EMDR. Because I did some research. I always wondered, like, I was in college and like, why aren't we talking about trauma more? Why are we still like focused on all these older school modalities and therapies? And aren't we talking about things that are actually helping to process trauma? And EMDR was one of them. And I did some research, and what I found was some therapists have a hard time with EMDR because of how it works, right? And that needing to really be quiet and sit there and this kind of also trust the process, and be very on to do that. So I understand that, and I get that. And I think with ITR, because it's like you do the art, you do the art work, then you narrate that work, and then you repeat it, and then you do the dialogue, right? So there is a step by step process for it, and it works. Um, and to see and you see that in the outcomes, right? You see somebody like, well, even, you see somebody like myself that goes in with, PTSD positive and comes out with a much lower PCL score, right? Which, is one of the assessments for PTSD. In some cases, I've seen the outcomes be that they come out with, they're not PTSD positive any longer, right? And so I did not necessarily have that quick of a experience or quick of a response with ITR. Now, I'm sorry, with EMDR. I will say that with EMDR, my therapist also approached it with intensives, similar to how ITR is. It was the intensives that I often did get the most out of and the most progress in. So, yeah,
That makes a
but
lot of sense.
mhm, yeah,
Well, talk about your desires and what you see yourself doing in the future.
yeah. So I am, because I experienced what I experienced. Let me start that. So, right, I know what it's like to just, again, not be able to function, to lose everything, that scary feeling. I understand when I would be on my hands and knees at times, like just like praying that the level of pain I was feeling emotionally, sometimes physically, would just go away. And really, really in those times wondering, like, how am I going to get to the next step? How am I going to stand back up? It was in those moments I was like, oh, this is why people kill themselves. This is why people commit suicide. Or when I would be extremely numb, like a void of emotion. Now we know numbness is an emotion and it's an emotional response, right? But this feeling of being completely void of emotion, like I remember once when my mom was life flighted from where she lives to a hospital in Morgantown, West Virginia. And my sister-in-law called to tell me. And I remember sitting there and thinking, I know I'm supposed to feel something right now. So I'm going to need to act like I feel something right now. But I felt nothing. And again, it was in those moments that I was like, hey, this is why people cut themselves. This is why people harm themselves, just to feel something. Or also, if the pain's so great, it's to feel something different to get that pain to stop. And so I have that appreciation and understanding of how that can happen and why it can happen. And I also have the appreciation and understanding of we don't have enough people out there to support PTSD and trauma responses. And there's not enough people that truly understand how trauma impacts the brain. There's a difference between um, behaviors that develop because of environmental factors or because of events in our lives and biology compared to stressors and trauma and injury to the brain. And I think we try to treat trauma and injury to the brain as the prior. And that's where we use a lot of these cognitive type of therapies for. So we're just not trained as providers to truly, truly treat trauma and help people recover from it. And I am of the mindset similar to ITR, and again, this came from my therapist before, but treat the trauma, see what's left. And, for me, the depression that I would wake up every morning with a gray cloud, and I just assumed that was normal. After a while, I was like, okay, this is normal. It's going to be life. And then after starting EMDR, I was like, oh, so like the anxiety reduced, that gray cloud went away. There were a lot of things. I was like, wait a minute. Some people probably would have thought I had bipolar disorder because of that up and down highs, right? And actually somebody suggested maybe I did. But these were all symptoms of the trauma. Those were all symptoms of the PTSD. Once we treated the trauma, those symptoms subsided. So again, we need to get that out there. So for me, what I'm really passionate about and really, really want my next steps to be are to train and to speak. So I want to help train providers and individuals so that they have a better awareness and can seek the resources they need to get better and recover and to better understand themselves, right? And understand maybe what is happening and why it's happening, to help reduce stigma around it. And then also, like with providers, giving them more tools because we live in a traumatized world. I was working with a provider or one of my coworkers, and just talking about she had just mentioned that about 75% of her cases were they had trauma history, and she found that most of the modalities she'd been trained in weren't effective, and she wanted to be more effective. She's like, I'm, their help. We were talking about the fact that they help you cope, they give you coping tools and skills, but these people weren't getting better per se, right? And so that's why she started taking EMDR. And then, of course, I told her all about ITR. So she's excited to learn more about that because we need people to understand that there are actually modalities that can truly treat trauma so people don't have to live with the symptoms of trauma and can finally get their lives back and finally live a fulfilling life. Because living in trauma, and I don't know how many times in my own treatments I have come out and said, if people don't get support for this type of stuff, it's really difficult to actually fulfill potential. It's really difficult to live the life that people want to live, because your brain it's like getting a broken arm. And this is one more thing, I'll close on this with this, is I use the analogy that if somebody goes to the doctor for a broken arm, right? There's only a very few specific types of treatments. Like there's a certain way to fix that arm, right? There's not like 10 different ways to do it. There's just, a couple probably, right? I'm not a doctor, obviously. But I think this makes sense, right? You go in, they need to set your arm. If they don't set it correctly, you're going to have problems with it. But they have to set it with a couple options to help it heal, right? And then if you don't treat it at all, then that arm's going to be really difficult to use for the rest of your life. And it's going to keep flaring up and give you problems. The brain's similar when it's been impacted by trauma, right? So my perspective is there's really just a few types of treatments that really, really help process trauma so the injury to the brain is no longer there, or at least is, again, healed to the point that we still maybe have some issues of flare-ups every once in a while. Yes. However, you understand it better and you can function fully or at least optimally again. So
You mentioned that you worked in HR, and I think that is really one of the biggest places that we have to train because how effective would that be if HR leaders in the HR world could recognize this in their employees. What do you think about that?
Yeah, no, for sure. I mean, we know that stress and workplace stress has increased significantly. We know that our workforce, mental health conditions related to work have been on the rise. And I think a lot of that is, stress. It's also like a lot of things that happen to work are like bullying or, even just that pressure to get things done can result in stress and injury for the brain. And so, yeah, I think that, it's about early intervention, right? So if you can get in there and work with people and help them understand what's happening, give them these tools, then hopefully you can prevent that injury to the brain from happening in the first place. Or if it's there, yeah, if the HR staff and teams and managers understood what they were seeing, they could better support their employees with something like ITR. And like I know one of the great things I love about ITR and the approach of ITR is that a lot of people can learn how to use it and apply it. Right? It's not just about um, healthcare professionals using it, right, or therapists using it. That it's possible for others um, to learn to use it and apply it effectively and appropriately. Yeah.
Yeah, even on themselves.
Hmm.
Because there's a lot of people that, are in such a situation where they could do it themselves.
Hmm.
There's other times where, we want to be educated enough to recommend a mental health professional, perhaps when it's like really complex trauma.
Hmm.
But I think too, like what you were saying for HR staff, nurses, people that are like anyone working with people, which is pretty much almost
Teachers.
any profession, to be able to
Hmm.
recognize that like someone's having a traumatic response and how to help ground them and do these
Hmm.
things like just initially
Hmm.
instead of adding to it, like,
Right.
sending them to a mental ward when it's really they just need some grounding. But, also recognizing that people come into fields with, like, early childhood trauma, and it
Hmm.
might not even be the work, but the work just might trigger it, but to recognize the trauma response.
Hmm. No, I think that's a great point. It is about recognizing trauma response and the grounding, right? That grounding that is so vital so you can be present enough to make a conscious choice of what's next, like what next step to take, right? And so I think that's teachers, actually. I think teachers need to definitely, I mean, they work with students again, they hear horrific stories. So one, they could benefit from understanding the grounding and ITR, but then also working with their students who are going through really tough things and having trauma responses for different reasons. I think that would be highly valuable as well. So again, yeah, I'm like all about the more people who can learn and understand what trauma response looks like, why it's happening, and what you can do to support it in the moment is, I think we just, it would make such a huge difference in our communities and yeah,
I
kind of
agree.
the whole.
Just the whole idea of peers, and those can be students too, like where we could take a
Mhm.
group of students that are really excited about supporting other students and train them, so school counselors could have some support. 'Cause I even heard from school counselors that if the grounding can happen with the educators or other students, like how much better they would be able to operate because they say all they're doing is grounding people like all the time, so they can never really get any farther than that. So,
Mhm.
well, thank you so much for this and really bringing this awareness and the discussion of the importance of having this in so many different professions and just the
Mhm.
HR idea
Mhm.
was a great one too. So thank you for sharing and all the work that you're doing, and we look forward to working with you more.
Yeah, thank you. I enjoyed it, and I look forward to doing more work with ITR as well. Yep. Getting it out
Awesome.
there important.
Awesome. Thanks, Rhonda.
Mhm. Thanks,
Take
Mary.
care.